So anyway, my name is Joanne. I'm a physical therapist. I've been a physical therapist for at least 35 years, if not a little longer than that. And I started this manual physical therapy clinic about 8 years ago, 2016. And we have one specific specialty, and that's chronic pain. Now, having said that, there are going to be one-offs, who are like student athletes and all other different things, like gymnasts and dancers, baseball players. But other than that, our real focus is people who have tried everything and nothing works. And there's a reason behind it. And at the end of this, my hope is that learning what we're going to discuss today is going to give you hope that there is a solution to your problem and that it can be natural, that it doesn't have to be as drastic as, having surgery. And that if you are taking all kinds of strong narcotics, that there is hope for you to actually stop taking those medications, because as we all know, that's not really good for us, especially in the long term. So I'm going to move on to the next screen. So one of the biggest questions that people, they don't necessarily verbalize it, but this is really and truly when they're in pain, this is the big question that they often ask themselves, which is, how long will this pain last? Now, in the beginning, when we start having pain, we tend to ignore it because we think, given time, it's going to go away. But in the meantime, as we're continuing to ignore it, we start to compensate, and then it just wouldn't go away, right? And so 3 months after you are dealing with pain, it becomes a chronic problem, right? And so you still ignore it, right? You just kind of modify your behavior, you start compensating, and then it gets to the point where it gets so bad that it takes things away from you that are important, right? And so when it wakes you up at night, when you can't sleep comfortably anymore, when you hesitate to walk on the beach because you know that you're going to pay for it after, or if you have to drop the frequency of your golf or tennis, then it becomes something that you will pay attention to, right? Or if you can't travel, or you're worried that if you're going to travel, are you going to enjoy it, because you're worried about all the walking that you're going to have to do and maybe even negotiate stairs, that's when you pay attention. And the other thing is, especially here in Florida, around Christmas time or during the holidays and spring break, we know that grandkids are going to come and visit. And then you worry that they're not going to invite you if they go on trips to Disney, for example, because you can't walk that far. So especially with back pain, knee pain and hip pain, any pain from the waist down, that translates to affecting your independence, right? Those are the pains that usually limit your ability to walk, limit your ability to stand, limit your ability to sit. And so those are the ones that really, after a while, it affects your way of life, your quality of life. And so by the time, you're past the 3 months and it's become chronic pain, usually when they end up coming to us, one of the first things that they emphasize is, I just want to get rid of this pain. I want pain relief. And I actually joke about it sometimes, and I go, no, you don't, because really and truly, what you're looking for is not pain relief. It is those activities that are important to you that you are already having difficulties with, or something that you're going to have to quit doing. Those are actually the ones that you are wanting to get back. And so we understand that. And so to us, if you're having back pain and it wakes you up at night, then if you want help from us, the goal is for us to give you the ability to go and sleep better. right? If you struggle with walking on the beach, then our goal is to make you get back to walking on the beach or maybe walk your dog in your neighborhood. So same thing with golf or tennis. That is truly what you want, is to get back to these activities because that equals quality of life. And so those are the things that we want to give back to you because that is truly what you want. Now, having said that, even if you don't come to see us, you know that really and truly that's what you're after, right? And so I want to give you a short backstory about why we are different than traditional therapy. So this is my little girl. She's actually 22 years old now. Her name is Jules. She's my younger daughter. She was born very premature. She was born 3 months early, 2 pounds, 15 ounces. So she's essentially my miracle baby. And you can see that as a complication of that very early birth, she had a brain bleed. And so it's essentially like having a stroke when you're 1 day old. And that's what happened to her. So I knew that she was going to have some physical disability. So I was prepared for it. But the one thing that I took away from when the doctor broke the news was when he said, the accident, the stroke already occurred on day one and it's done, right? The accident's done, it's over. All I have to do is manage the pain. And so I took that to heart. And it's the understanding that whatever I see in her, yes, I can say when she has some abnormal movement patterns, I get it. It's from the, from the bleed in her brain. But there's a little part of it that gave me hope, which was because of these problems, her body started to compensate in order to function. And in the process of the compensation, when I addressed the compensation, she became better. And in fact, her pediatrician at that time was amazed how independent she was, or how we managed to get rid of her walker and braces. She doesn't even use brace. And as you can see, this other picture, that is her. That picture was taken last summer. She spent a couple of months in Taiwan, and she was hiking some mountains and swimming with wild turtles. So that gives you an idea of how independent she has become. And currently she is actually in Missouri going off to college. So anyway, the reason that's important is because that experience I had with her was what brought me this different way of solving the problem. And so it's called, I call it a body recalibration method, which is really understanding that when there is a problem, the body is so smart that it starts to compensate. And so if you just look at it as the compensations, what if you correct it and you try to bring the body into a normal function? You will actually do better, and you can shut off your alarm system, which is your pain. Okay, so there are two ways that we recalibrate the body. One is called fascial recalibration. So some of you are familiar with the word fascia, and some people will even call it fascia. It doesn't matter to me. But it's like if you look at a piece of steak and you see the white marbling and the gristle, that's fascia. And that connects you from head to toe. And imagine when you're compensating, you actually twist your fascia. And so essentially, it's like saying that you're wearing a t-shirt and a pair of pants, and they're all twisted from all the compensations, right? And then you try to function normally. Of course, it's going to be uncomfortable. So once you recalibrate that, you'll realize that you're actually able to move more fluidly and, freer, and that there's going to be less pain. So that's one option that we have. Once that's recalibrated, the other option is called muscle recalibration. And so muscle recalibration is about correcting the actual muscles. And the best way to explain that is like saying you are a Rubik's Cube that is misaligned, and then we are going to release one muscle at a time And that's how we recalibrate you. So no, having said that, I know that you're not here just to hear about the clinic. I just wanted a little background so that you'll understand where I'm coming from when I start talking about your back, hip, and knee. So the question is, why is it that I didn't want a workshop about the back only, or I could have had just a hip pain workshop or a knee pain workshop? Well, I'm here to show you that those three problems coexist. They actually affect each other. And so if you just try to relieve your pain and just focus on the knee, for example, and you go to traditional therapy and you just say, hey, my knee is hurting, you don't realize that that's also being affected by your hip and that's being affected by your back. And so you have to look at it in a more holistic way. And when you do that, you get to figure out what the root cause is. And so, is your body even capable of what you're asking it to do? It's a very good question, right? So as you see the lopsidedness, which is a consequence of living in pain, when you say it's hard to walk, well, you have to step back and think the way your body looks like, is it even capable of the movements that are required to walk? And oftentimes when you look like this, it's not capable. So the simple answer of this is, what if you work towards making yourself less lopsided, right? You're going to realize that you're going to be able to function better. So, I want to just point out that for people who have had friends, or even you yourself, if you've experienced a hip surgery, a back surgery, or a knee surgery, and you are disappointed, it's not necessarily the surgeon's fault. Believe me, we see them all. And typically what you're dealing with is the fact that once the doctor corrected the spine or the hip or the knee, it is now able to function normally. So it's going to expect the rest of your body to function normally as well. So when it can't, it's going to set off the alarm system, which is your pain. And that's why those people that have had surgeries, they usually feel great the first 3 months or maybe 6 months, and then the pain starts creeping up on them. So typically with these types of problems, it occurs between 6 months to about 2 years. If you ever experience that, that is typically the compensations that you're dealing with. And so it is not a failed surgery. If you just correct the asymmetry, you're going to realize that the doctor actually did a good job. All right. So pain is, like I said earlier, it is just the alarm system, right? So it's just like, imagine when you have gas pain. How do you know you have gas pain? Because your stomach hurts, right? You get rid of the gas, pain goes away. Same thing if you have a broken arm or broken leg, it's excruciatingly painful. But once it heals, the pain also goes away. So essentially, whether you have a broken arm or a gas pain, it does the same thing. It causes you pain, just different intensity. So that's telling you that pain is just the body's way of telling you something's wrong with it. Well, if you look like this and you're lopsided, so that when you function, you're not doing it normally, the body is also going to tell you. So if you're not capable of walking, of the movement required for walking, when you walk, it's also going to tell you, hey, I'm not capable of walking. I'm going to hurt you in the back, the hip, or the knee. So that's kind of how we look at the problem. So imagine if you do this and you recalibrate your body, right? Even though you have arthritis, stenosis, but what if you address this part? A lot of times you will get relief. You may not have complete pain relief, but what would life be like if you get 50 to 75% relief? Imagine what it will do to your quality of life. And that's kind of why we are, we are so passionate about teaching people, look at it from this angle, because this is the angle that gives you hope. And because we see it time and time again, we know this is effective. And so anyway, just to give you an idea, some like a body that looks like this, where there are 8 different problems that we typically see, it takes about 2.5 months to recalibrate the body. So imagine if you've been dealing with pain for 20 years, 10 years, 5 years, and then in 2.5 months, you will significantly feel better, not because of anything, it's not a miracle that's happening. It's literally just recalibrating the body. That's all it takes. So if there's one thing that I want you to take away from this is the hope that you don't have to live with this pain. Okay, so what are examples of lopsidedness? Okay, how do you know that you are? So one, you can see the feet. You can see that one is pointing out more than the other. You can check, excuse me, you can check this. What's interesting about this is sometimes, let's say the right foot is the one pointing out, and then when you stand up, it's the one, it switches. So that also tells us a specific, excuse me, problem. So that's one. Now, you'll also notice that this one is about the shoulders, right? So in this particular case, in the bottom picture, she is actually, her rib cage is twisted to the left. That's what's happening there. But she thinks she's neutral, but her rib cage is twisted to the left. And so when that happens, it changes the way you walk. And believe it or not, this seems crazy, but how your rib cage is positioned will significantly determine where most of your body weight is going to land on your feet. So that is why it's important to look at the whole body, because they're all connected, as you know, and so it makes a difference. All right. So let's say you've had surgery, right? And 6 months or a year after, you still have pain, and you keep going to the doctor, and your surgeon says there's absolutely nothing wrong. I did a good job. There's nothing wrong with it. Well, if you're one of those people, what I'd like you to keep an eye on is forget about the knee joint itself, okay? Because remember, the surgeon usually, they've fixed it and they've been successful at it. But look at this one on the left, where there's a hip replacement. You will notice where the arrow is, that one hole that's actually called an obturator in foramen. One hole is actually smaller than the other. So that actually tells you which direction the person is turned. I'm not going to go into details, but I just want you to keep an eye on that. And this one, you can't see it very well, but this pelvis is actually tilted. So one is lower than the other. Okay. There's another one, and this is pretty significant for a hip problem, where this is the sit bone. And when you look at the sit bone and look at the distance to this little bone right here, this is your thigh bone, and you can see that the distance there is closer compared to this one. So those also tell us, where the problem is. And going to the knee, what I want you to look at is, you see these 2 bones, that's your tibia and your fibula, and you can see that one of them is a lot closer and the other one is narrower. That is a classic example of a tibial torsion. And tibial torsion that is muscular. I have another picture that shows you how we correct that. Okay. I found it sad one time. I was at a doctor's office, and I pointed this out to a surgeon, and I said, do you think that the tibial torsion is the one that's creating the problem? And he dismissed me, and he said, no, it was just taken. It was just that the way he was standing, or the person was standing, was kind of crooked when the x-ray was taken. And so he shrugged it off as something insignificant. And I'm thinking, exactly, the person is crooked. But anyway, I figure if you understand these, should you be in this situation, at least you're going to look out for it, because I find that surgeons or even just, orthopedic doctors or just regular doctors, they don't really look at these. Okay. So let's move on to what other lopsidedness you're going to see. All right. So on the left, you will see that her shoulder is lower. Okay. The right shoulder is lower. And you can see that there's a wider gap on the right side compared to the left. Now, what's very interesting about this is that you can see that she was wearing the same thing. This one in the middle picture that was taken after her treatment, and you can see that she has now become more symmetrical. But do you remember how I said that we're all connected? So in the process of correcting the hip, you can see that the right shoulder actually dropped even more compared to the other side. So what that means is by correcting the pelvic area, it affected the tilt of the rib cage. And so the next move, and unfortunately, I don't have the picture of what I did the next time. So that means that once you correct the pelvis, you have to move on and correct the rib cage. And so that's why I said you're like a Rubik's Cube. We move one and it changes the other, and you just keep chasing it until somebody is symmetrical or recalibrated. So the other picture, you can see also that the right shoulder is lower. You can really see the head tilt here, right? So she's stepping to the right. This might be a little subtle, but you can see that the right arm is actually hanging sort of behind her a little more, and then the left one is actually more forward. So that tells you that at least in her rib cage, her body was actually slightly turned to the right. Okay. Now, if you look farther down, I don't know if you can see it. Of course, this is my job, so you can see the little subtle things. But her right hip is actually touching her forearm on the right side more than it is on the left. Okay, there's a little bit of space here. And then if you look down farther, okay, here you can see that the left foot is straighter and the right foot is more angled, right? And she actually thinks that she's straight. How do I know that? Because I told her, okay, march in place. I want you to be straight. And you can see that she really was not. Her perception is that she was straight, but she's not. She's crooked. So those are like subtle things that I would like you to observe, after we're done. And you're going to notice these things. Okay. All right. So just to go back to this, so the question is, when we have people coming in and we point these out, some people will actually say, oh, I know that. I know my shoulders lower. I know one is higher. I know I'm twisted. And that's because the chiropractors have already discussed it with them, massage therapists or, other physical therapists. And I'm not here to bash them. I'm just saying that is our experience. But the question is, when you see that in your body, what are you going to do about it? And that's usually the biggest thing, is that you're aware that it's there, but you don't know what to do. Well, we are very fortunate that we have the ability to recalibrate the body. All right, so I'm going to talk more about the back. Okay, so this is something that we hear often, people being diagnosed with spondylolisthesis. So I just want to show you the picture of what that looks like. So you can see the different levels of severity, right? So what that means is when it starts to slip, so you can see that this bone is starting to slip forward, and then it became more pronounced, and then it get worse and worse and worse. So a lot of times when people have the diagnosis of spondylolisthesis, the back surgeon will oftentimes recommend back fusion, okay? And you can understand why when you look at this picture. If you ignore it, the doctor is going to say, well, you're going to end up paralyzed, right? So imagine if this is in the neck, you can really be paralyzed, or if it's in the weight from the waist down, you can. And so that's why fusion is very common. Now, what's the downside to that? When you fuse these parts, for example, these have a job, a very specific job that they do, right? And then you fuse it. And so when you do and you still live your life, then the upper part is going to take over and do the job of the ones that were supposedly done by the ones in the lower part. Well, the top parts, they're not designed for those certain movements. And so sooner or later, you're going to, or those areas are going to start hurting. And that's why you hear of people who have multiple fusions where they start small and then they just keep going and going and going up until before you know what, the entire back is fused. Okay. Now, usually when you have a spondylolisthesis diagnosis, trust me when I tell you, you will very likely not have these problems. You will have these problems. I've seen multiple x-rays, and usually these are the ones that I see. Okay. And so in our world, when you really think about, well, what if I can correct or minimize the spondylolisthesis by muscles, right? There is hope, because here is a very good example of what's happening. So you see this highlighted muscle that is called an iliopsoas, right? And if you look at the second picture on the right, it's actually a muscle that attaches from the front of the spine and it attaches to the front of the hip. So it's a diagonal muscle. So when that's tight, it's going to pull those bones forward. And so what if you release that so it will stop pulling it forward? You actually will prevent the spondylolisthesis from getting worse. So that's what I mean by what if you can release some muscles and you don't have to have surgery, because especially with spine, it should be the last resort, knowing that there could be complications, right? All right, so let's move on and show you another problem. So this is an SI dysfunction. I feel so strongly about sharing this with a lot of people because this is often an undiagnosed problem. So you can see where the green part is, it's a sacrum and there's a pelvis, and you can see that it's literally just two bones that are stuck together. That can actually become unstable when you become lopsided. And it's a question of the chicken or the egg. But regardless, that is very common. You don't see that on x-rays usually. And these are the, how do you know that you have it? Well, it's very simple. If after sitting for half an hour, you get up and you feel so stiff and painful, you know, your hip or your knee are hurting, and then the first few steps are painful and somehow it gets better, that is a classic sign of an SI joint dysfunction. Now, if you ask the doctor that, they're going to say, oh, that's actually just blood flow going, or some, you know, whatever, the joints have warmed up and there's more blood flow and that's why the pain disappears. All right, even if I give you that and say, okay, maybe that is true, but the point is there are 5 muscles that are responsible for this. And when you correct those 5 muscles, you lose these symptoms. And that's why I disagree with that explanation. I also want to point out to you that an SI dysfunction can create a leg length discrepancy. So if you go to a chiropractor, usually they will point that out and then they will recommend a shoe lift. If you have a shoe lift, please find out if you have a true leg length discrepancy or you have an SI dysfunction, because if you actually have an SI dysfunction that is creating the leg length, you are in trouble because you are just making your problem worse. Okay. If you want to know how to find out about that, you can give us a call and we would be happy to show you how you can do it yourself, or you can come over and we can also assess you to determine that. Now let's talk about the knee. Many times when there's a knee problem, there's bone on bone, there's arthritis, right? And you're ready for, you know, the doctor will say, well, I need surgery because of the bone on bone, you know, like severe osteoarthritis. Well, one of the things that are often misdiagnosed. And I'm not saying that there's no bone on bone. I'm just saying that's not necessarily the one that's causing the knee pain. So this is a way that you can assess if you have this problem. It's called a tibial torsion, which is essentially if this is your thigh bone and this is your lower leg, there is a twist. And so if there is a twist, it's going to cause pain, right? Because again, it's an alarm system telling you something's wrong with you. So in this is a very simple test. If you find and hold your kneecap, and then this is actually the shin bone, at the very top of the shin bone, if you put your thumb there, and then you look at the relationship of these three. Ideally, it should be smack in the middle, and you can see that this one, the bone is actually slightly off to the side. So that means there's a twist. The picture on the right, I don't know if you can see it, but there is like a little redness off to the right because this was taken after our treatment to correct tibial torsion. But you can see that at this point, after we corrected it, that it is now more symmetrical. And this is a really good way to correct a knee problem without having to resort to surgery. Or for those people that have had surgery and they're still having problems, this is oftentimes one of the problems. There are other things, but I just want to, today is about educating you and being aware that it is much more than just bones, because I don't know if you know this, but there are only 206 bones in the body. There are well over 600 muscles. So I find it very interesting that we always blame bones for the pain. Now this one, I'm not going to go over this too long, but it's just a question of, we see so many people say, I have sciatica. And if you look at this, it's actually not sciatica. It's actually muscle. The yellow parts are going to cause you pain. Okay, so these are examples of muscles that are tight. And when they're tight, they will cause pain in the areas that are yellow. Why the yellow? Because the yellow is the attachment of the muscle. And so just like if I pull on hair, right, and I'm tugging on it, where the hair is attached at the scalp is where it's going to hurt. That's the same with muscles. It's going to hurt where it's attached. So if anything, all these yellow, if you have pain, it gives you hope, right? Now, what I want to point out is, remember how I showed you about the shoulder that's lower? You can see that one of the causes of that is actually a shoulder muscle. It comes from here and it goes to the back and it goes all the way to your tailbone. So this, something as innocent as a lower shoulder can actually create a low back problem. One more thing, doctors will say, or surgeons will say, if you have a groin problem, very likely it's time for surgery. Well, guess what? There are muscles that attach to the groin that can also cause pain. So again, I hope that this gives you hope that maybe you don't need surgery, that there is a solution that is a lot more natural. So you can take a picture of this. So I'm going to give you tips. The two that are very, very important, that's why I'm bringing them to you right now, is please, if you can avoid crossing your legs at the knees, that does so much to causing you back pain, hip pain, and back pain, hip pain, and knee pain. So if you have to cross your legs, cross at the ankles, okay? And then just forget about being feminine. Just like, if the legs are going to spread out, who cares if it saves you some pain? And the other one is avoid pivoting, because if you have an SI dysfunction, it can, and if you have a tibial torsion, pivoting is going to twist it even more. Now, I listed our office email because I would like to send you the proper sleeping position tips, and then the body self-assessment and exercise tips. And then the other thing is this one exercise that we call the pill, because anytime you have a back pain, a hip pain, or a knee pain, you do this exercise, it will temporarily realign your SI, and that gives you relief. So we call it the pill because it's like when you're hurting, you take a pill and you feel better. So I hope that you will take advantage of that and reach out to us so that we can send it to you. Okay. All right. So what are the next steps? When you reassess yourself, I would like you to reach out to us, okay, and just kind of find out, have a better understanding of what can be done about it. So what are the next steps? It depends where you are, right? So if you're very skeptical and say, nah, that's not for me, I would encourage you to give us a call. We'd be happy to talk to you for half an hour, whatever it takes, an hour, just so we can at least give you an understanding of what could be your problem. If you're kind of interested, but you're not sure where the right fit, we can give you a 30-minute discovery visit that is completely free. Or if you are ready and serious about getting back to doing the things you love, we can schedule an evaluation. And for you who, I really appreciate the fact that you are attending this, webinar at 6 o'clock when you could probably be preparing a meal, to show you my appreciation. Today, if you're interested in doing the evaluation, we will give that to you for free. Evaluation costs $350, and we would gladly extend that to you. So send us a text or in the chat. If you are interested, please type in your phone number so we can reach out to you, or you can also email us. All right, so I hope that was helpful. Now, if you have any questions at all, this is the time to ask. So, hold on. Oh, okay, there you go. So I forgot this slide, sorry. So you can actually scan that barcode, and that leads you to our website, or we also have our phone number there. And I even have my cell phone there. So feel free to take a picture of that and, give us a call. We'd be happy to extend that offer to you today. Okay.